Welcome to another Brief Bite for better care. Today, we're looking at culture in healthcare. Organisational culture has become a popular concept, but what does it mean? A simple way to think of culture is that it's like personality. It's the personality of the organisation. It's a hidden but unifying theme that shapes the way a hospital or healthcare organisation functions. Recent research has shown that the hospital's culture has a direct bearing on the quality of care. Not just patient satisfaction, but better health care, including fewer complications, a reduction in errors, even less death. So what are the factors that produce hospitals and healthcare facilities with this type of culture? The research shows that culture is strongly linked to the attitudes and behaviour of the senior managers and the senior clinical leaders. If they're inconsistent or punitive or dysfunctional, this increases the risk of harm to patients in that hospital. There are 5 key factors in improving culture. 1, senior management clearly supports the clinical teams. Not just token involvement, but authentically involved and engaged. 2, staff from a range of disciplines become involved in the organisation's management and in the hierarchy. 3, where everyone feels safe to speak up when they think something's wrong or if something could be done better. 4, where there's a learning environment. A spirit of inquiry where people constantly ask, how can we do this better? Not more cheaply, but more safely. And of course, we now know that a welcome side effect of reducing error is that costs are reduced. A learning environment where mistakes are seen as opportunities to learn, to improve, not as opportunities to punish and create fear. And 5, where conflict is resolved fairly and where staff feel cared for. This type of culture is good for management, it's good for staff, and it's good for patients. It's good for management because management finds that involving clinical staff sharpens their focus and keeps their eye on the right ball. It's good for staff because they learn that by direct involvement with management, they learn about some of its complexities and they feel they have genuine input. And most importantly, it's good for patients. It leads to better results, fewer complications, and better care. What's the culture like where you work? Senior managers and clinical leaders determine a hospital's culture, but whoever we are, we can all play a part in improving the culture of our workplace. See you again on Brief Bites for better care.